do you feel being at Must?
I feel very good. Must is very good. I encourage many vaccies, many students who have not yet pursued the courses that they do want to come at Must in a medical school. It is really good. If at all you come to Must as a medical student or in the faculty of medicine, it has very high chances of you getting very better jobs in the job sector, because Must competitively in the job sector is better than other universities in the medical school. I really urge you guys to come and join Must. You will find people here. You're going to find very good lecturers. You're going to find very good personnel here. The environment is very conducive. We have some good birds that sing for us. We have some good animals that sing for us here. Yes, you'll come and enjoy Must for you. Must is here for you.
For everybody. I always
Yes.
wanted to come to Must, but I didn't get enough points to join the medical faculty. So, briefly, what's your course about? What do you do? When someone hears medical laboratory, they might not know what that course is about. Tell us, what is it about, briefly?
So medical laboratory science, first of all, is the cornerstone of medicine. For medical laboratory science, as you hear laboratory, in this laboratory is where we are going to diagnose, or this is where we are going to check your body fluids or your body samples for us to see or get a definite diagnosis. For diagnosis is what the doctor uses to prescribe drugs for you. So as the medical personnel, what do? We are going to take onto your samples, or we are going to take your samples from you. We can get CSF from you, we can get blood from you, we can get oral cavity swabs from you, we can get any type of sample from you. Then we go check these samples in our laboratories. Then we ascertain which type of disease or which type of bacteria or which type of parasite, anything of that sort that is in your body that is not supposed to be there. Then we diagnose it and confirm it with our laboratory tests. That is all about laboratory science. But laboratory science does not work on itself alone. It has different organizations that it works along with. It has the Allied Health Organization, that is the biggest brand of the medical laboratory, which takes upon other medical courses. But medical laboratory science, as itself, it is the first segment of the medicine, which diagnoses, or it is the cornerstone of medicine that is going to tell you which actual disease that you do have. It gives the doctor what to prescribe.
Wow. And now you are in your 4th year.
Yes.
The last thing I can ask is, how do you feel? Are you ready to go in the field to work?
Apparently for the field, I think I'm very ready. Why? Because must gives us the capability, or gives us the ability to interact with different patients one-on-one. Since our 2nd year, I've been interacting with different patients one-on-one with them, and we get to know how different patients do behave, how different diseases do behave, how different outbreaks do behave when we're in this laboratory sector. So I think I'm very ready to work, because I've worked on very many patients from my 2nd year up to my 4th, and I'm still working on patients. I think I'm very ready for the field. And they've taught us many skills. They've taught us the GCLP skills, which are the good clinical laboratory practice skills. We have obtained certificates from those laboratory skills.
Wow.
From all those laboratory programs. We are very certified to go in the medical field and work.
Are there any challenges you have faced throughout your course, and how have you overcome them?
The challenges, as I said, those were the cadavers, first of all, the language barrier. Yes, I talked them before, but there are also other factors that can come in. For example, the work speed. Yes, and also the writing of reports. Because for every practical we are supposed to do in class, we're supposed to write reports of every practical that we do.
I get you now.
Yes, so the workload becomes too much, but either way, we came here to study.
Yeah. So those who are coming very soon from your high school, be ready for the workload. By the way, every university I go to, students tell me the same thing. Workload. We didn't expect this much work at the university. I also studied so hard, and by the time I graduated, I didn't want to see a pen or a book. But I managed it. And after that, I went straight to my master's degree. So, right. If I'm to take you back to what you said initially, where you had to change your course, may I know why you applied for that course in the first case?
In the first case, in my Form 6, I got 12 points, but I didn't get the point or the cutoff points for the program that I wanted. I wanted Bachelor's of Pharmacy.
I see.
Yes. So then they told me, for you to get a Bachelor's of Pharmacy, you're going to do a bridging course. But this bridging course was the heck. And this heck, you'd get points or a first class for you to automatically go to medical school. But in this new case, of course, first we are the pioneers of HEC. Our cohort, we are the pioneers of HEC. So in this cohort of the pioneers of HEC, it was us to set the background of, it's
I
us to
say.
set the baseline for everything that is going to happen here in HEC. So here in HEC, you would, I did HEC BC, that is biology, chemistry. There is HEC PM, that is physics, math, and there is HEC CM. So this HEC is in the Faculty of Science, but I had to cross from Faculty of Science to go to the Faculty of Medicine. And that is a very hectic thing because it is difficult for a teacher to come become a doctor.
I get you now.
Yes, that is very hard. So in this new course, you had to do what? You had to work hard. The very first thing, you have to work very hard and get a very first class upper, not lower. Because a very first class upper is one that is going to move you to the medicine faculty. If at all you get a first class lower and below, you will still stay in the Faculty of Science.
You cannot shift.
You cannot shift.
I get you
Then,
now.
there are also other circumstances where you can shift a course, not majorly because you didn't get the course of your choice. This is how you applied, and the course they gave you is not the course that you wanted, or it's not a course that you do want. So what are you going to do? You're going to apply for change of course. It is in the first 2 weeks of the application. The very first 2 weeks after the application, that is when the change of course is there. And it happens when you want to change a course. Then they give you the due time. Then after, if at all it is okay for you, because of your cutoff points, they can change the course for you. But if at all the cutoff points are not so wanting, they cannot change your course.
Oh, I see. So when you're applying for a course, I mean, the course they give you, that is the results from the government,
Yes.
right? Because here in Uganda, you don't apply for a course like universities abroad. The government, you apply when you are still in high school, and then the government decides. In the choices, they give you one of those or something else, right?
And no, there is the due course when you're not, the first government list first gets out. Those that are in government, the government list gets out. Then there is that private list where you're going to apply you as a private person, but not on the government list. When you apply for the course that you do want.
But is there a possibility that when you apply for that, even if you are privately sponsored, they give you a different course?
Yes, it is. It can apply because of the cutoff points, and cutoff
I
points
get
can
you now.
shift because of cutoff points shift because of the different courses or the different years. A year can come when it has more than 20 points
I
in
get
a
you
year.
now.
Then there is a year that will come when the best has 18 points. So the cutoff points will have to shift in one way or the other.
I
So
get
that's
you
how
now.
change of courses come in, and your cutoff points give you the course that you do deserve.
Wow, you must work so hard. You wanted to do pharmacy, right? But at the moment you're doing medical laboratory. Well, when you came to the Faculty of Medicine, why didn't you go to pharmacy? That's what you wanted in the beginning.
I wanted the bachelor's of pharmacy, but then I got some mentorships from the different doctors, PhD holders who had done pharmacy. But they told me, for a girl, let me say what they told me. For a girl, it is difficult for you to be so much into the business school, because pharmacy is more of business, but business in the medical school. Yeah, so they told me for a girl, it is better to do the bench work, and medical lab has more of the bench work, which is going to be on seeing the different samples of patients, the urine, the stool, the blood, the pleural fluid, and all the different fluids that are in the body, or the body cavity fluid and everything. That's why I opted for medical lab. And also it's supposed to go hand in hand with your parents. Some parents also want different courses for their students, because it's not us who pay the tuition ourselves. Some parents don't want other courses apart from what they want. In fact, there are some parents who would want, I want you to do medical laboratory science, and you have no choice. And that's why it all happens here at campus.
Oh, I see. Okay, I was just trying to understand why they said it's not good for a woman to do the pharmacy thing. It was your passion.
Yes.
So did they give you any reason why?
They gave me some reasons, because they told me it's apparently it is very competitive, and most people who have the better pharmacies are males. So being the competitive when you're a female, it may at some point be hard for you. And the better competition for female is in the laboratory sector, and the medical laboratory sector. And for female, they easily coordinate, or they easily interact with patients one-on-one than the male people. Yes.
I get you now. Before we finish, as a leader, you've been here. Now you are like a native of MUST, right?
Yes.
What are the 3 unique things about MUST?
In leadership skills or
Anything, opportunities, whatever it might be. Or this university, unlike other universities here, this, and that done.
So unlike other universities, must